Welcome, everybody, to another Voices with Vervaeke. I'm very excited about this. We're back again with Terri Dentry and her ongoing work and this ongoing video series. Many of you have been reaching out about wanting to participate in this work in one way or another. And I'll do this again, but I wanted to thank many of you for your interest in that. We also have Aspasia Karageorge with us, and she already knows Terri. I've just before we turn on the camera, I've been getting to know her. She's very charming, and I look forward to us opening this up, getting back into these deep issues around chronic pain, the meta crisis, the meaning crisis, and issues around interprofessional practice, dialogical reasoning. Many of these topics, we're weaving them all together in powerful ways. And Aspasia is going to give us a more of a clinical therapeutic dimension, but I imagine she'll also want to talk about some of these far-reaching dimensions. So welcome, both ladies, and I'll turn things over to Terri.
Thank you, John. That was a great introduction, and I also welcome Aspasia. I've got to know Aspasia over the last 12 months. Again, someone I've met through Voicecraft, so a wonderful place to actually meet like-minded people. Through our discussions, our earlier discussions, we were talking about, of course, my research work in chronic pain, and Aspasia has a clinical background and works as a clinical psychologist. And we've come to understand that we have some very similar feelings and thoughts when we do think about chronic pain, and especially the term socialization of pain, which is something that John and I have been talking about to quite some length. And I'm really excited to talk to Aspasia about that today, and actually how potentially rationality fits into the way that we actually think about that socialization of pain. So I'm going to let Aspasia introduce herself and her work.
Thank you, Terri. It's a real pleasure to be here with you both. And John, I did just want to say that you've formed a very important part of my life. It's really wonderful to finally meet you. I think it must have been like 6 years ago with my baby son. He had trouble sleeping, and I used to listen to your lectures when I was pacing back and forth all night, exhausted. And so to meet you is really special. So I just wanted to start with that and to thank you for that.
Thank you.
So yes, I'm a clinical psychologist. I'm a therapist. I see people in private practice. I use a modality called ISTDP. So it's a psychoanalytically informed modality. It's very emotion focused. It's experiential. So it's all about creating experience in the room with patients. And it wasn't designed for chronic pain. It was designed really for depression, anxiety, personality disorders, that sort of thing. But it can be used for chronic pain. So it also relieves chronic pain and somatization and an array of things. And we can talk about why. So I'm interested in talking about that in some depth. I'm interested more broadly in the role of emotions. I think they're sort of the forgotten landscape. I think there's an over-focus on rationality, cognitions, and we forget the emotional landscape and how to take that into account. And I think that happens from very early on in life for reasons we can talk about, but also socially. I just think it's reinforced socially in the culture. I don't think there's a strong enough understanding of what emotions are, how they can be helpful, how they can be enlivening. Particular emotions are prioritized over others. So we can talk about that in a lot of depth. Mm-hmm. And also the socialization of pain, I'm very interested in. The idea that, what I see all the time, that chronic pain, as well as depression, as well as anxiety, all of these sufferings, these undue sufferings, actually play a role in relationship. And this role that they play in relationship reinforces the symptoms themselves. And there's a few different ways that I can talk about that, and probably in some ways that are maybe different to what you've already considered in your conversations. I think because the model is psychoanalytically informed, there's a lot of focus on the unconscious and the role of suppression and repression, and trying to bring the unconscious up into consciousness as a way to relieve the suffering, which I think is a really important part of the mix. For a subset of people, I think more CBT and sort of very general emotional work is enough. But for many, many people, there is a lot of unconscious resistance against experiencing their emotions, and that they're not aware of. And so taking time to help them understand what those defenses against emotional experience are is vital. And without that, what can often happen is that symptoms can just move around.
Mm-hmm.
So someone gets, some relief to their pain, for example, but it may be that it manifests somewhere else later on in life, or it now manifests as anxiety in a different context, or depression, or sexual problems, or all sorts of things. So I'm interested, I guess, broadly in emotions getting more of a platform. That is because of the work that I do with ISTDP, which stands for Intensive Short-Term Dynamic Psychotherapy, the type of therapy developed by Dr. Davenlu in the 60s, I believe. And it's a very, we can get into the details of it, but essentially it looks at it would look at chronic pain as being a defense against emotional experience. And so it's another way that we can avoid particularly painful emotional experience that our psyche, for whatever reason, has decided is too dangerous or threatening to bring into relationship. So for us to A, even be aware of internally, and then B, to now how is that going to impact the relationship? Will this person reject me, punish me, whatever it is, for having this feeling? So all these defensive structures and mechanisms get created, and ISTDP is really about getting very clear on what the defensive mechanisms are that are in operation, bringing that into sort of stark relief for the patient, highlighting the internal emotional conflict that's going on, the intrapsychic crisis, and then helping to push through the resistance so that some of these feelings can come up and finally be experienced. And it gets experienced in the room together. And one more piece I will say is that I have found that I think the most confronting part and the resistance that is greatest is the resistance against the impulse, or the action impulse, the action tendency that comes with an emotional experience. So it's not just the sensation and the feeling itself in the body that is resisted against. In finally letting oneself experience that fully inside, there is an impulse that comes with it, which is the whole point of an emotion, right? And seeing that impulse, recognizing that impulse inside ourselves can be very confronting. If it's an aggressive impulse to reach out and hurt someone, that's a very confronting thing to look at. So there's a lot of resistance around seeing that part of it, but it's in the seeing that part of it, not the enacting, right? Just the noticing inside, that can finally clear up the need for all these defenses, right? So it just clears up anxiety, it clears up depressive symptomology, it can clear up chronic pain, and opens a person up to be able to experience their emotions more clearly and more fully, and that gives them greater potential in their action. That's what I've found. It gives them more options now. They have more information to draw from, to integrate with, obviously, cognitive, rationality, bringing all that online with the emotions, working together, as opposed to just looking at one part of it and pushing the emotions down. I've said a lot all at once, but that's where I'm broadly interested in how I think it might be relevant. And I was saying to Terri too before this started that I'm also a researcher, and actually I was a researcher before I was a clinician. So my mind also naturally goes to how can we, what are the practical implications here? What is it that we can take from this very complicated model, that we're not going to be rolling out to everybody? What can we take from this? What are the key ingredients that might be useful to OTs, physios, GPs, nurses, anyone that's coming into contact with someone with chronic pain? What can they take from it? So my mind is sort of in all those places at once, and just more sort of broadly philosophically as well, because I've been spending a lot of time at Voicecraft, and those generative conversations with that core group there it's just been wonderful, and it's really opened me up to all of this in a new way as well. So those are all my different little lenses that I'm bringing to this.
That was wonderful. Thank you. So you said it. You said about 20 very interesting things. So I'm afraid no matter which one I'll pick, it'll sound like I'm being negligent, but hopefully you'll be understanding. So I frequently say that for ECOG, I should have two more E's added. Not only is emotion embodied, embedded, enacted, and extended, it's also emotional and exaptive. And so I think there's I've been making an argument for quite a long time about that at the core of cognition is something called relevance realization, but relevance realization is not cold calculation. It involves caring, it involves affect, it involves arousal, etc. So I think we're playing in the same ballpark, at least. So, in what way does everything you've said connect up with some of the stuff that Terri has been doing about the degree to which this is enculturated and socialized? For example, you said you're familiar at least with some of my work. I think being stuck in a Cartesian framework has particularly and getting a very truncated notion of what rationality means, where it goes from a very Platonic notion down to this very logical notion, and their eros is drained out of it, deliberately so, by the way, whereas Plato was a great emphasis on the relationality and the eros. So in what way does the cultural cognitive grammar, the framework we're in, does that, I imagine that gets internalized, that's an impactor, that's an amplifier of the kinds of stuff you're talking about. Is that correct? How does that land? What comes up for you when I say that?
Yeah, a lot comes up. And the answer is yes, that plays a role, and I see it play a role in just so many ways. First of all, I think I don't think there is a grammar for emotions out there. Like, I don't think people understand what we mean, at least as psychologists, when we say an emotion. People automatically go to action. So if I say to you, what is anger like for you? They go to, oh, it's someone lashing out or saying mean things, or, well, that's an action. And so the idea that there's even any sensation in the body as a beginning point is often absent from people's minds. There's an idea, this idea out there that we should be controlling our emotions, which again, really, I think people are talking about actions, but you can't control that. The fact that these are biological hardwired signals that occur within us, we don't have choice over, seems to be absent from the mix. The idea that we generate our emotions, we can sort of curate and create this inner landscape of joy and only being positive. All of that being reinforced by things like social media. But also just in family units. It starts young. It's in the family unit. It's oftentimes in the schooling system. It's often what happens when you go to see a doctor. It's just in culture at large. And I think a lot of it is about the prioritizing feeling good and looking like you're doing well, and overriding even just the divide between sort of positive and negative, that some feelings are good and some are bad. And they're all vital signals inside us that can tell us something very important. They have a wisdom to them. And that we don't take them seriously in that manner is a real problem. When it comes to pain specifically, it's quite often the case that people who I see who have chronic pain issues, once you can get very clear with them how interesting it is that they also seem to have an absence of emotional experience, but they have a lot of physical pain, that can be quite confronting in and of itself.
Is that a general trend? Is that
yeah,
what you're saying?
I'm going to speak in a lot of generalities, because there's always, I don't want to act as though there aren't distinctions here. But yes, in a general sense, what happens is, I guess from an ISTDP perspective, in some of these cases. You have to do, I think one thing to say is you have to meet the individual in front of you. And there's always a possibility it's very different. But in general terms.
Just take it that we'll give you charity around that. Like,
okay. All right, good. I hope others will as well. I'm not so concerned about
well, they should. They should.
Yes. Okay. All right. I appreciate that. So in a general sense, yes. I mean, if we're thinking about, from an ISTDP perspective, if we're thinking about chronic pain here, operating as a defensive structure to keep the person from noticing that they're having a particular emotion, and we can talk about why, then they just notice the pain. The pain operates to keep them from noticing the emotion. So rather than notice the rage that I might feel towards my partner, right, for deciding to leave their job and now putting me in a greater financial sort of burden, right? Rather than notice that, all of a sudden I've developed some pain in my back, and now, so it's rather than notice the guilt that I might experience for doing something that ruptures my relationship with my child, I just notice this sort of crushing pain in my arms, right? Or I notice, pain in my head or in my neck. So they notice the pain as replacement, as like a distraction from noticing the emotion that precedes it. And so when you can draw it out and say, wow, as we talk about this and look at the sort of the timeline of this, it seems like there were really difficult things happening in your life. Your mother passed away, you lost your job, like all these things. And then you develop this pain, but I hear nothing about how you felt about any of those things.
I see.
How did you feel? And to even just notice that's almost the first time they've considered that question. And they say, oh, it didn't really bother me that much. My mother had a great life. It was her time to go. It's fine. I get it. I didn't really feel a lot. Or, they give you some watery feeling, or they're making it into a positive feeling. You notice that it lacks the richness of an entire emotional landscape that one might imagine someone would experience if they were going through difficulty. So the pain, so it's like the same thing as we would say about anxiety and depression. It's sitting as a cover to keep this stuff squashed down so that the person themselves doesn't have contact with it, but also so even if they start to have contact with it, so that it would never come out into the relationship. So that you would never let your partner know that you're very angry at them when they keep interrupting you, and you've pointed it out to them several times and they continue to do it, that you feel a great anger inside when they do that you believe that would never bring anything of value to the relationship. But what happens with these emotions is that they have to go somewhere, they have to do something, they have their own life. We can't just cut them off and throw them away. So they go underground and they fester and they come out in all sorts of other unconscious ways. And so some ways that we see that in ISTDP, especially when it comes to pain, is that the pain itself can be a rerouting of a rage and impulse to hurt someone else. Instead, they experience it on themselves. So there's very often a link. Once we do all this work, there's very often a link between the precise location and nature of the pain they're experiencing and the initial impulse that came with the rage in the first place when they were younger, probably against an attachment figure. It's the same expression, but it's being expressed in their body rather than to be inflicted on the other. It's a way they protect the other from an impulse to hurt the other.
Yeah.
Does that make sense? So
yeah, it does. And there's a couple. Oh, sorry, am I interrupting you?
No, go for it.
Yeah. So I just want to make sure. So part of what I'm hearing, there's three things I'm hearing. And you can respond to all or none of them or whatever order. I'm hearing like that there's both sort of a vertical dimension, emotions are a signal about what's going on, but there's also this horizontal dimension of if I'm connected or not to external reality, right? And
yes.
And either I'm trying to not admit something about the world, or I'm trying to hold myself back from interacting with the world in a certain way. And this goes with sort of the idea of, which I think has got merit to it, that emotions are sort of this nexus between these two axes, right, of connection, embodied connection and embedded connection. This is why I think the E of emotion should be added to embodied and embedded. So first of all, what you think about that. And then there was, I like this idea. I don't know quite what the word semiotic or symbolic, that where it isn't just happenstance. There's some kind of meaning to it, that and confronting the meaning is part of the issue as well. And then the third is a question. So those are my two observations, and please let me know if I'm tracking you well. And then the other one is it, given sort of how we got into this with my original question, when you're doing therapy, is there an element of cultural critique that has to come up, that you have to challenge people in terms of these cultural frameworks and give them the tools, to challenge? Because like you said, they're going out and you're saying, something for an hour in therapy, and then they're going out with 4 hours on social media. Do you see what I'm saying? It sounds like it's in some ways the game's rigged against you. And how do you deal with that? And what do you do? Do you have to do things, cultural critique? Do you have to empower them to challenge those cultural imperatives? So 2 observations and a question. I hope that wasn't too much.
No, amazing. I'm going to start with the last one. Because what happens, John, is that if when this is done and it goes well, from my point of view, it's all about the individual and I in the room, right? And it's less so about maybe like a CBT style psychoeducation. Let's talk about the theory. It's all about trying to give the experience in the room to this person of what we're talking about, right? To show them here and now together, right? If we pay attention right now to your pain, what happens? Like using the relationship and using the here and now to help them see the gaps. And to see that actually something might be off here in the way I've been approaching this and understanding this everywhere else, but we keep it very much about the experience in the room. And it's a corrective emotional experience that is taking place. And you're right, it is just 1 hour and they go back out into the world. But it is amazing how making it experiential in the room starts to translate out into the world anyway, without me needing to say, now you need to take this out and do that. Because otherwise, the problem is otherwise you get into a game of talking and intellectualizing and over-rationalizing. And now you back into that same arena again that is part of the problem for many of these people. Part of their defensive structure is they like to think and talk about things and go up here a lot and make lots of connections in their brain without actually consulting their body first, without going in and noticing what is the truth of the emotion here, even if I don't want to see it, even if it's going to be disruptive to a relationship I'm in. And the part that you said at the end of your question about empowering them, what generally happens is once we get on the other side of that in the room, they're empowered themselves. I don't have to do anything. It opens up. There's this thing called the unconscious therapeutic alliance, and it sort of takes over, and this person, their healthy part just sort of takes over, and they are opened up and they know what to do now. They are empowered. I don't give them any advice. I don't say to them, oh, you should probably leave your wife or not leave your wife. Or it's clear to them on the other side of it. They don't need me for that. They don't need another person in their life sort of listing out the pros and cons of what you could do in the situation. Their problem is a blockage in access to vital signals that might help them to see more clearly what is going on for them and in relationship. And through seeing more clearly and having access to these more vital signals, they can integrate that into their thinking faculties, which most of them have no problem with. The people I see, John, are, highly intellectual, people, they don't need more help from me about how to think. So they oftentimes put all those pieces together themselves on the other side of it. And that is beautiful to see, because that actually is part of the healing, that they can say, wow, I can just figure that I've figured this out now, and I have agency in the world. I don't need my therapist to tell me what I should or shouldn't do in this relationship, or how I should feel about social media. It's just clear to me now that, yeah.
Thank you for watching. This YouTube and podcast series is by the Vervaeke Foundation, which, in addition to supporting my work, also offers courses, practices, workshops, and other projects dedicated to responding to the meaning crisis. If you would like to support this work, please consider joining our Patreon. You can find the link in the show notes. So just, one pin in it quickly. So that last move really was helpful to me just before you address the other two. That notion of sort of a recovery or restoration of agency, that seems to be like an important thing. So that seems to be that's what I was asking for. I wasn't necessarily like, I was like, but something has changed such that they can go out and confront a world that is in some ways driven them into your office in the first place. And it sounds like there's a restoration of agency in some, and this is a theme that Terri and I have been really trying to explore what that is and how that sort of comes online. I just wanted to put a pin in that because for me, that really helped me connect your answer to my question. But you wanted to respond to the other 2 points about emotion as the nexus and the symbolic aspect.
Yes. But I'm tempted just to respond to the point you just made now as well.
Do what you wish. Do what you wish.
No, I will. It links really nicely to me to a conversation that I had with Daniel Garner of OG Rose recently. We were talking about something similar to do with emotions and this distinction about agency that you're talking about. So what it seems like to me happens is that in highlighting, because really what we're doing in ISTDP is we're highlighting the conflictual nature of the internal emotional landscape. It's about the fact that there are complex mixed feelings in there towards people who we both love and at times might feel intense rage and want to rip their head off. Right? How does one have that experience inside without thinking there's something wrong with them or, self-attacking or trying, So what this work does is it really highlights, on the other side of it, it highlights for a person that they have complex mixed feelings inside themselves, that they can have two parts sort of, together at once. Then they can choose how to act. They don't have to act from the rage part, and so the agency comes, and this is sort of more wording that came from Daniel, but the agency, I think, comes from noticing, there is something inside that is complicated, and now I get to choose how I act. So that is the distinguishing point, as opposed to trying to edit the internal landscape to precisely match how they're acting, if that makes sense.
It does.
The noticing that there is something inside that I can wrestle with and which to make a choice from, that allows me to feel I have an ability to make choice, as opposed to the other way around. And I think the problem with pain is that pain is read as, this is just a thing in my body. This isn't an emotional experience. So there's nothing here.
Yeah, but that's the pivot point I'm trying to get at.
Yeah.
Because like one of the things, well, from my side, I feel like I'm wrestling with, theoretically, is the association of emotion with passion, where passion means exactly the loss of agency and being overtaken, and pain also. Yeah, right. We suffer pain, right? We're losing agency in our pain, and I'm just sort of seeing, like, is there a connection there that, right? It's like you have, when people move out of, the passivity of pain and they get away and they see that emotions can actually, right, afford their agency. And see, that's what I'm sort of hearing is, sorry, this is just, right. Does that make sense? Because like one of the things I bump up against when I try to teach students about, the cognitive importance of emotion is that notion that but emotions are passions. We undergo them, and they are losses of agency, and they overwhelm us. And an emotion is a passion. It's the opposite of an action. And it sounds to me like there is this Platonic point, right, where people, they realize, no, emotion affords agency. It's not robbing me of choice and agency. Am I hearing that well?
Yes, you are hearing that very well. Yes. Yes. And certainly there are cases where the learning around emotion has been one where, the impulse becomes scary because it may overwhelm action and all these sorts of things. There is that side of things as well. But often I think that the move here is that this damage, if we call it that, happens so early in life. It's an attachment relationship rupture of some kind. Which leads to all these defensive structures coming online. which then leads to a lifetime of just having this distance from our emotions. So the way that we are understanding what an emotional experience might or might not be like is completely removed from the truth of what it could be like, because we've already got the defensive structures in place. So in terms of pain, one way of thinking about chronic pain here that relates to this point is that if the pain is being driven by an inability for a person to consciously experience the emotion of guilt, let's say, because a lot of this isn't just about anger, which gets a lot of airtime in kind of the spheres where I am, but it's about the guilt the child then has about noticing the anger. So that's actually the more difficult emotion for a child to bear, and for anyone to bear. It's a very difficult emotion, very painful. And so rather than having that, they experience pain, which defends them from the emotional experience of guilt, but it also helps to serve the guilt. It's a way of saying, I'm a bad person, I should suffer. Right? It's actually, this is what I mean about the wisdom of emotions. Once you can get clear with a person that an emotion's not there for no reason, what's its story? What's it trying to do? What's its associated impulse? For guilt, the impulse is to reach out and repair, right? I want to reach out. And guilt's about a specific action. It's not the shame, right? Which usually operates as self-attack. It's just another way of turning anger in on oneself. It's to reach out and repair. It's there for a very important biological reason. It's there to facilitate relationship, not to destroy it. But instead, so instead, for various reasons, because people have never had an experience of being able to tolerate internally guilt, anger, grief, emotional pain, because it happens so early in life and because it's in the context of an attachment relationship, that they are so biologically driven to just hold on to at all costs, right?
Well,
doesn't matter what you have to do. Yeah.
It has evolutionary provenance. I mean, if you don't have an attachment figure, you're dead.
You're dead.
Yeah.
Absolutely. And so it makes sense at that time. But what happens is this model then carries forward for the rest of our lives where it no longer makes sense. It's outdated. But we're not even aware of the model. We're not even aware of the frame. It's all unconscious.
So does your modality talk to attachment theory? Or does it talk to EFT, things like that as well?
Yeah, it's grounded in attachment theory. Again, if it becomes relevant, you might explicitly speak to the patient about it, but it's all experiential. But so what happens broadly speaking in ISTDP is through, first of all, lots of groundwork, starting to notice emotions inside, the patient starts to notice emotions inside themselves, and we can get clearer about what those are. And if we don't pay attention to the pain and we look underneath, what are you feeling? And so when they're looking underneath the pain, they get clearer on the emotions. And then we facilitate them having a full internal emotional experience, which means that they have a full set of sensations in their body, which are quite reliably consistent. So, for example, anger and rage is usually a heat that sort of starts in the belly, it radiates upwards, it can go out the hands, the arms. People feel it all of a sudden once all these resistances are out of the way. They can feel it and experience it in their body. And then with that, it's that, and what would it want to do? So we're trying to get to the impulse. What does it want to do? What does it want you to do, this feeling? And so it's this imaginal walking through of the impulse. They can get to a point where they can, describe in detail what the anger would want to do to their partner who, I don't know, didn't put away the washing yesterday or whatever it was, right? And some of this is getting out of the way of rationality, because what happens is they step in then to cut it off and say, but that makes no sense. I shouldn't have rage towards someone for not putting away washing. I can't have that feeling. So we try and put all that to one side and say, maybe the emotion will show us why it's here and why it's so intense, right? So through this, so they have the full experience. They talk through the impulse. Sometimes the impulse is to the point where the person is dead, quite often. And then through then seeing that, then they can often experience the guilt that's trapped underneath that, to see this, imaginal sort of dead figure. All the feelings come up, the waves of grief. This is done over an extended period of time for some people. For some people, you can do it sort of in one big go. They have all of this, and then often what happens, John, is that through this, they actually see in that imaginal portrait, they see all of a sudden, oh, it's not my husband, it's my mother, or it's my father. Like they see the transfer of they see the other person who it relates to. And then they have a memory come to them spontaneously, right? And this of some event in their childhood that they've forgotten about, or they sort of remember but haven't really remembered, and now it just comes to them vividly. So I'll give you an example. So, a guy that comes in and say his presenting complaint is that he has crushing pain in his wrists. And, he's sort of had issues with pain all his life, and he's had this a bit all his life, but it's become really bad recently, and he doesn't know why, and doctors can't help him. It's so bad that he's had a child recently, he's had a daughter, and he can't even hold her, right? And so, through this work, we might come to find that the crushing pain in his wrists is a cover for what has happened as he becomes a father and starts to pick up his infant daughter. She starts to reach out and touch his face, right? And everyone says, "Oh, how lovely! This is so wonderful. Look, And at the same time, this crushing pain has come online, and he can't pick her up anymore. So what we come to find through this extended sort of form of therapy and doing this imaginal walking through of the emotions is that actually, when he was younger, his mother would get in his face and hold him by the cheeks, right, and scream at him, right, like the baby crying, scream at him and be dysregulated in front of him. And he was terrified, but he couldn't move. And this is his mother. But when we drill down into it, he had an intense rage towards his mother at that moment, which wanted to reach out, grab her wrists and crush them so that they would let go, right? But he never experienced that. He could never tell me that before we met and went through therapy. And so he comes to realize that, this crushing pain that I feel in my wrists has been activated by my baby daughter reaching out and touching my face, which a part of me has intense rage about. But I would never notice that because it's my baby daughter and I love her more than anything and I'm supposed to protect her. So he protects her by feeling crushing pain in his wrists, which is both a rerouting of the impulse, but also works, this is the relational thing, also works to make him unable to pick her up. So now, even if the impulse ever got out, it can't get out because I'm impotent and I don't even pick her up. So now he protects her in a second way with a second layer. By now he's in a situation where he'll never be in the situation where she'll be holding his cheeks. But he knows none of this consciously at the start. So there's this whole sort of understanding about how this is working in relationship that is really fundamental here. And I'm aware that I've probably gone wildly off track to your original question. But
no, that was very helpful. I mean, we can leave the original question aside if we need to. I thought what you did was actually more to the point. I do want to give Terri a chance to
yes.
to get involved now. She's always very gracious, and she lets me sort of do this for a bit and open things up and make connections, which I appreciate because often she's introducing me to people. But I think it's a good time now to turn things back to Terri.
Thanks, John. Thanks, Aspasia. No, I just really enjoy, especially this time, enjoying the conversation. I can certainly see so much of it in the things that we've talked about before, and especially in relation to our thinking of this socialization of pain and how our narrative bias is driving a lot of this. So, the narrative bias coming from the early childhood experiences and that providing the bias to what we are giving us a filter, of how we are then relating to these things as we go forward in life. One of the things I wanted to ask you, Aspasia, is about when you are in these moments with someone in therapy. I know you've spoken about being in the flow state with them before, and I'm really interested about how you enter into the flow state, because to me it sounds like you're cultivating an environment, an emotional environment where you're allowing insight to come forward. And that's, again, goes to John's point where you're saying, like, what happens after you leave the session? Well, now they've got some wisdom that they've gone away with and they carry that with them going forward. So what it appears to me is that you're cultivating this ability to have emotional insight in the moment, and you are creating that experience between you. So it must be very special feeling to be in from both sides, as the therapist and as the patient. But what does that bring up for you?
Yeah, there's I think this is the word I've used with you before, Terri. There's a sort of an embeddedness that's what it feels like to me when I'm really with a patient. And what facilitates that, I think, is just really focusing in on the relationship, the one-on-one relationship. And obviously, even for the therapist, that can be very confronting too. So, there's being aware of all your own stuff as well. So the way I think about it is there's sort of lots of theory and lots of thinking outside of session, and then you come to session and I try to just let all that fall away, which is in itself anxiety provoking, and feel sometimes like I have no idea what I'm doing or where we're going. But it's just keeping the relationship front and center. And the question in my mind really that guides that is, how close can I get to this person? How close will they let me get to them? And how closely can I connect to them? How vulnerable can we be here? Emotionally. So the work of that, really, the groundwork of that is, which can take a very long time, is trying to bring down the defensive structures. So getting clear on what are the defenses that are getting in the way of us emotionally connecting, pointing those out, and then there is often a real battle inside the patient about what they're going to do about that, because they've got two parts in operation at once. So once the part of them, and this is, I think, fundamental with ISTDP, the idea that there's always a healthy part, we call it that. There is always an unconscious part inside a person that is striving for this emotional liberation and this opening up, right? That is a fundamental tenet of it. And so some of this is about trusting that part to help guide us as the clinician. But that is the part we're trying to get in contact with, and we are using sort of metaphor and other forms of language to speak to that part as well.
Mm.
So once that part rises up against the part that says, no way, we never let someone get that close to us, especially not another woman. Like last time I did that, it was disastrous. Women never get that close to me. This part is going to try very hard. Once this part can finally break free, that is when the defenses go down, and that is when the person has more ready access to their emotions and they just become spontaneous with it. There's no more resistance. That is when this flow state, I would say, is occurring. It's when you can see it, you get the sense in their eyes almost. But it calls for me to also connect in the same way. So I need to be connected to my emotional landscape. And that can be confronting too. But everything else falls away. Like it's not just me. Other therapists who have been using this model far longer than me, talk about the ways in which even their perception changes. The way that they see color might change. There's a change to the state of mind. There's just a change in the moment. It feels very different, and you're just with the person. And when I'm like that, which is not all the time, probably very infrequent to be honest, but at its best, things come to me as well. Like I find myself sort of saying things, and they just somehow are the right thing to say that is helping to bring up whatever needs to come up. So there is a letting go and a trusting of an unconscious component here, which is part of the model. And that relates directly, though, to the way that the emotion is understood as actually being kind of this, it walks between the unconscious and conscious, I guess. Yeah. I don't know if that answers your question.
No. Really interesting. So, as you know, in the work that I did with the two different practitioners working together, many of the practitioners talked about it being transformational for them to actually be part of that environment. And I think you've spoken a lot to that, even though you're the practitioner on your own in that session, which is probably taking on all the burden, because I know that you're a very holistic practitioner and you're looking at the whole senses of the person in that room at that time. Can you just a little bit more about the language? You mentioned metaphor and thing that you bring to the table, but one of the things we've been talking about with John is about how the practitioners also need to have a common language that they can use so that we can get to this point with people, so we can help them to understand what's going on. Part of the problem is that we don't have a common language between practitioners and people who need the help. So how are you working with that? I know you sort of said and alluded to the types of people that are coming to you, and I'm assuming they're all coming to you of free choice as well. So that's a thing. But yeah, what obviously you've probably done quite a lot of work on this in the past to actually decide what kind of language you'll use and how that works for you.
Yeah, that's a really, really important point. I mean, I think even the word unconscious is really off-putting for many people. So, I think using something like hidden or trapped or can be useful. So just talking about the idea that, it's quite common that when it comes to depression or anxiety or chronic pain of the nature that you're describing, that it is a signal. It's a signal that our brain is giving us to protect us from something else that's happening under the surface. And the idea that, under the surface there may be hidden elements or sort of trapped elements under there. And usually these are emotional in nature. So that would be the way that I probably talk about it. And if we can get to that's sort of the engine, if that's the thing that's driving the need for these other symptoms to be here, because they're firing to try and keep us distant from what's happening under the surface, then if we can maybe bring this up and out and look at it, you and I together over time, very carefully at a rate that you're comfortable with, we can just see what's there and see if we can put all our assumptions aside and try and make have a look at what it shows us. That might help your brain to see that it doesn't need to be doing all this on the top anymore, and this actually can fall away. So the anxiety and the depressive symptoms and the chronic pain that you're experiencing may no longer be needed because you've brought this scary thing, this thing that your brain has decided is very scary and you should never look at. But you've brought it up and out into the light. And hopefully in doing that, we might see that not only is it okay, not so scary, but also that it might tell you something really important that helps to clear up your vision. It helps you to understand yourself and how you are in relationships so much more clearly. And that is usually the link for people, Terri, that's really helpful, because people often present with, I don't have confidence, I'm paralyzed at making a decision, lots of self-doubt, I want to feel confident. Well, the confidence comes from this agency piece we were talking about, that actually access to these things that are trapped under here might be the thing that gives you more information, that allows you to see more clearly, and therefore it feels easier for you to make decisions. It seems clearer to you about your desire and your preference, and that you can act in the world with that. Is that what you meant by language?
Yes, yeah, because I've certainly found in all the stories and the people I've spoken to, when it comes to persistent pain, so, pain of different types, so emotional and physical pain continuing for a long time, then quite often it's been a case of there being guilt and shame sitting underneath that. But that's the last thing people want to talk about. It's very, very difficult to get to that place of being in that vulnerable position to actually talk, because we just don't have a natural place to start from to talk about things like you said, anger is something that we do know how to talk about, because we talk about the actions of anger, but we don't really have a way of talking about guilt and shame in the same way. But we have an awful lot of narrative bias that are held by guilt and shame, we just don't find a way to talk about it in the same way. What are the actions? What are the things? How is it feeling in us when we have these emotions?
Yes.
Could I say something here? I just want to pick up on the language theme, if that's okay. Is that all right? Because I want to take it a little bit further, because I want to talk about not only language in therapy, but between therapies. And what I mean by that, and because this is also an aspect that I heard in Terri's question, maybe that's not what her intent was, but I was. So, for example, let's have somebody who's coming to you because there's good reason to believe that the issues that you describe are taking place in them, but they also actually literally have like some damage, muscular damage, and they're needing to do physio and things like that. And what's interesting is some of the language you were using around the imaginal and the, how things are metaphorical and embedded. I mean, if you take a look at like Nick Winkelman's work on the language of coaching, and he talks about you have to give people enactive metaphors so they inhabit their body in different ways, and they learn through these imaginal practices, how to move in a different way. And that feeds back into a different sense of agency. And part of what I heard in Terri's question, and I'm not attributing anything to Terri, but Terri and I do talk about this, is like, but what kind of language could we use that would help you and the physiotherapist? It's not, instead of talking past each other or politely disliking each other, or the kind of thing that might happen because you come from very different worlds. You're talking about an inner world and the unconscious, and presumably they're coming from a very physiological, mechanically oriented world. And if we just use those two languages, you're not going to talk to each other, and the patient's going to then, right? But if we said, well, wait, there's this imaginal, there's enacted metaphor, there's the way the body can symbolize things, and there's a way we can get that to open up and between us. And you used language from, you used one of the 4 E's. It's embedded and it's dynamical. I'm interested in that. I'm interested in, so this is not language you'd be using maybe right in therapy, although you might use it in front of the patient when you and another therapist are talking together. And Terri, does that land for you as also a dimension of the language issue?
Yes, definitely. I wondered if maybe we extend that, Aspasia. Have you had experience working with another practitioner in the room?
Yeah.
That would be really interesting, how you reflect on the language that you use.
Not with ISTDP. I have worked with other clinicians before, definitely using other forms of therapy, and probably more helpfully. I mean, I've worked on lots of research projects that look at team practice and look at sort of innovative ways to respond to clinical complexity, and some of that has exposed me to some of these ideas and thinking about how this might work in practice. So if I had someone like a physio in the room and we're trying to work together, I think this does relate to how I might talk to a patient anyway, to be fair.
Okay. I didn't want to pin you down, though.
No, that's okay. It's not choosing one over the other. Both are true. Is really, they both are true. There is a component here that working on the physical body is likely to give you some kind of relief. Mm-hmm, and there is here that working on the emotional, I just call it the emotional landscape. I don't even use any of this psychological, or just working on your emotional landscape will provide some relief. And wouldn't it be amazing if both things could happen at tandem, so you could have maximum relief? Like, if the idea is that this is a cycle and one is informing the other, they are ultimately, you can't separate them. And so if we can both be, working on one part of it, then hopefully together that provides maximum relief. I don't see it as a choice between one or the other. Both are true. Both are just different ways of looking at the same thing. And I don't think that, this gets a bit more broad, I guess. But my thinking is, I don't think that there is one ideal way that any human being could address the entirety of something. I just think we have a limited view by nature of who we are, and so we can work on that. And how wonderful to have multiple people working from different viewpoints together. So I would just talk about it as let's consider the idea that emotions are having a role here, and they're having a very real impact on the body. And so I don't know anything about, what might be relieving to the muscles and the whatever that you do. And I might have some role here in being able to speak to why it is that this is even happening in the first place. That doesn't mean that the physical correlates aren't there and that working on them can have some relief. But if there's an engine underneath driving that's about self-punishment, for example, then fixing this is just going to lead to that engine manifesting somewhere else in this person's life.
But just to take it further, you could say, given the example you had with the wrists and the being held, you could, the therapist could present the movement that's needed to do the damage and connect it to that metaphor and say, when you're doing this but think about that. Think about like getting release and being free from that, or what, you know, you see what
they could bring the emotion into it. Yes.
Yeah. But by giving them a bridging metaphor that bridges between the two therapies in an important way.
Yes. Yeah.
See, these are the questions Terri and I are really, I mean, we're interested in everything you're saying. I don't mean it to sound dismissive, but I'm also, we're interested in this. We're interested in what could we do? I mean, you're coming at this very wholeheartedly, and that's very appreciative. But, you know, some people will come in more hesitantly. And if we could say, right, you know, well, there's a way in which you two could co-create a shared language. And if we play around like we're doing right here, we might start to uncover some shared language that we could both use, and we could get the two therapies to work in concert rather than orthogonal to each other.
Yeah, no, I love that. I like the language. I like the language of opening up. So I think as opposed to release, I'm on the fence about the word release. I think that actually freaks some people out, and that's part of the problem. They think the impulse is going to be released out of them, and that's why that's part of the defense. Why the structure is there.
But that's exactly it. You could say to the physiotherapist, say, don't use release language. That's the wrong metaphor. Try to use opening up language. Right?
Opening up is like creating more space inside. And you can still do that. You do that with your physical body. Like I think about, you know, I used acceptance and commitment therapy for a long time. And the way that you would deal with difficult emotions there is to imagine more space inside around the emotion, right? It's an opening up, but it's still inside you. It's not about, I need to throw it out into the world because I can't have it. Because it's important that you see it in reality as being part of the inner landscape. It doesn't need to go into relationship, or it doesn't need to be enacted, the impulse. So opening up is nice. So you could talk about while they're doing the exercises, you know, can you feel how that is opening you up? Can you feel how that is opening up you know, it might also be opening you up to be able to see and recognize this anger in more detail as you do these exercises. I would talk about opening up as opposed to release. It's teaching the person that they have space and room inside to bear an emotion in a sort of graded way. But also opening up is metaphorical. Opening up means so many things.
Yeah, exactly. That's it.
Opening up possibility, opening up, you know, of relationship, of your life, of your movement in the world and your actions. So I think opening up is how I talk. That's how I talk about it.
Yeah, I just say that release is a very negative thing. So we release our anger, and it's actually quite often the thing we're trying to stop and hold back from. So that if you say you're trying to, you know, you're going to release something, it's like, maybe I need to hold that back, not do it, you know, so it kind of counts.
Well, if it's an aggressive,
yeah.
If you're talking about the aggressive impulse that comes with it, yes. But there is a way too that with this work you come to see that anger can be really useful, helps people to be assertive. The people that are passive and never take action, you can integrate the anger. And so now anger makes me realize I don't like what this person's doing, but I also love them. How can I tell them in a loving way? Really don't like what you're doing. It's hurting me. It's impacting the relationship. Oh, that can help us to connect more and actually make our relationship better. Anger can help me if I bring it in the right way to make the relationship better. So, but you're right. This idea that I think people conflate anger with aggressive impulse, and so the idea that you're releasing, exactly right. People would not want it. Or it also insinuates that anger is like a poison that you should never have, and you need to release it, get rid of it. That's the other.
And there's other potential connections. You talked a lot about sort of seeing in a new way and even inhabiting your body in a new way. And a lot of reason why people are like they have trouble in physio is because of exactly that. They're not inhabiting their body in the right way. And if you could get people to say, oh, like in both these places, I'm not inhabiting my body in the right way, and you could get those to talk to each other. You see, this is what I'm trying to get at. This kind of right. And what Terri's got some research showing that if the patient is watching you and the other therapist like co-create this language, especially in a way that's accessible to them, that has extra therapeutic benefit to it.
They're watching integration happen. So
that's right. Yeah.
They are witnessing their intrapsychic crisis.
That's right.
See, I don't need to say it anymore. Look, others are saying it too. Yes.
That's what we're doing in the therapy, John. We are trying to help facilitate them seeing that inside themselves. So a step to that might be to see it in front of them. Oh, and these are also two people who, you know, hopefully know what they're talking about. So I can't just look away and minimize and rationalize out of this. And they see it happen. And that, again, even on an unconscious level, may start to help them to notice it inside themselves and start to integrate inside themselves.
Modeling goes deeper in the brain than propositions.
Yes.
Really, it really does. It's very much.
And this also speaks to group therapy. Like I've been thinking, Terri, too, about, because I know you're thinking about sort of how are you going to take this and how can it be useful? There's a lot of these pain protocols that are being used are done in a group setting, and I think it's a similar thing. That being able to witness other people around you have their own wrestling match of this, and for some people, helps to see that more clearly within themselves, and maybe helps them to then be able to do that more clearly for themselves, right? But it's the needing to see it externally.
Yes, I think hearing other people's stories is amazingly therapeutic. It allows you to go see something in it that allows you to then to open up yourself and say, I'm not that unusual. There is something, I have a connection with someone on something, and I can actually say it out loud, and that actually helps you to actually then consider it yourself. Yeah.
Absolutely, Terri. And I think for people who are open in a particular way, that's true. I think there are also people who are highly motivated to avoid some part of themselves to any degree, and to hear a story that might otherwise do that for them. They'll find all sorts of ways to discount that story and dismiss it. And this is part of what happens. The highly resistant patient is the one that, something like ISTDP is really important for, whereas these sort of simpler forms that make up a pain protocol are going to be useful for another subset of people. The shared language, the opening up, the inhabiting your body. So it's true that for many people that intellectualize and isolate emotional experience as being something that's like a word that pops up in my brain, they have no connection to what it feels like in their body. And so that is the work. The work is getting back into the body, and they start to notice all these sensations in their body that they'd never noticed before.
I taught Tai Chi Chuan for a couple decades, and getting people to inhabit their body is a very difficult thing to do. And then people will often, if this is a big move for them, there'll often be the release of emotion associated with that re-inhabiting their body.
That's why they don't want to be in their body, because because it helps them to avoid the emotion.
Exactly.
Yes.
Exactly.
Yeah.
Yeah. I mean, I would love to think about that shared language thing in some more depth, because that is the practical takeaway here, isn't it? That would be useful to what?
Well, at least one. I mean, there's been lots of practical takeaways, but that's one. Yeah, I would say.
Yeah.
I think it's just something that we are collectively discussing. I think even just the action of discussing the need for a shared language is something that's, really helping us go forward, because it's a little bit more comes out each time we have these conversations, I think.
And I also think like the process of co-creating it in front of the patient is valuable. So I've been trying to do a thing where instead of this is in the scientific domain, but I think there's some analogy. Instead of just presenting the pristine final project, I've tried to do things where I'm working with other people collaboratively, and they're seeing the scientific process. They're not just seeing the finished product, and they take a much more participatory role in that, because they get involved with the generation of it, and they're not just pointing at the right. They're not just pointing at the finished product. They're actually embodying it, right? They're almost imitating it.
Mm-hmm. Sounds like voicecraft as well. I just have to say, like that's been my experience of actually being part of these sorts of conversations.
Yeah.
No, absolutely. I think too. I mean, I don't know if this would be useful or not, but in terms of that, the clinicians sort of talking together and what they're doing and what they're modeling, part of this work is getting comfortable with our own emotional landscape and actually being forthcoming about that sometimes at key junctures. And I just don't know, it might be useful for them to at least be bringing some of that language in when they're talking in front of the patient about how they're feeling, how they're feeling during this process, just to normalize it for one. I'd have to think more on how exactly how that might be utilized. But it would be strange if they were doing this in front of the patient with the goal of trying to model something and not be reflecting at all on their emotional experience, wouldn't it? And just be up here.
Well, hopefully, like I say, if they were involved in the process and not into the usual cultural drama of presenting the pristine product, that might make them more open to, like, a participatory relationship to it, rather than I am the.
Well, but even to say to one another as they're doing it in front of the patient, wow, as you point that out, I hadn't thought about that before, and I feel anxious as a result. Like,
Well, yeah, for sure, you should
put it on the table, and but how this is something we should look at, and like to really do the wrestling with something in front of the patient, as opposed to
I
avoiding
totally
and
agree.
acting. Yeah,
I totally agree. I mean, that's what I meant by modeling, right? They're going to be modeling it, right, to the patient, and not just. And it's also, it models to the patient the idea of participating and trying, rather, because what we're often also held back in certain ways because we carry around these sort of all or nothing mentalities. You either succeed or you're a failure. And that also it impedes a lot of this kind of work we're trying to do with people. At least I find that with some of my students, they get into this thing where they get very self-defeating, because if they can't give the perfect essay, then there's no point. And I'm trying to say, the word essay actually means to try, right? Like, you're supposed to be trying here, right? Right.
They've probably had very punitive authority figures in their past, right?
Very, very much not, and ongoing. There's very much.
With an authority figure, the idea that you could express to them your anger or displeasure at something that they're doing doesn't come into the equation. And so just noticing that you might feel some dislike or anger or irritation towards the person who's asking you to write this essay and asking you to put yourself out on the chopping block for, being marked and evaluated, natural to feel some anger towards that person. But they probably don't even realize that. They just notice their self-attack. It gets turned inwards. Now I give myself a hard time.
And it gets very twisted, because you can also find out indirectly that the parent is helping by trying to manage this problem, right? And coming in and we can fix this. And it's like, well, maybe that's not what you should be doing here.
Further activating all of this.
Yeah.
They're the originator.
And then you widen that out just to the local community around them, and then to the wider experience that they're having with all the other, meta crises and things that we've got going on. Then that is just all coming down on them at the same time. And
university is a prime example. It's people already high achievers, right? The bar's already so high. Most of them have got there through their own perfectionistic tendencies and self-punitive tendencies already, and it's just what they have to do is continually be assessed.
Yeah, and they're on Instagram seeing perfect lives that are, of course, and they know propositionally they're fraudulent, but that doesn't matter to other parts of the brain, right? That's right. And it has huge effects on them.
Mm-hmm.
Anyways,
we're
we're coming to the end of our time, and I want to thank you, Aspasia. I mean, that was just really, really well. I think we modeled to some degree what we were talking about. It became very collaborative, and of course, Terri, it's always wonderful to have you here. I'll give you two ladies a brief minute or two to do any summative or cumulative or provocative final words that you want to leave people with. Maybe Terri, you first, and then you, Aspasia.
Yeah, well, I just really appreciate the conversation. I think we've opened up a lot of avenues that still need a lot of exploration. So I'm looking forward to those. I think I'm really interested to talk further about this moment of the action impulse and when that happens, because the work we've been doing is really about this one turning point. And I think that we touched on it, and I really want to go, I think it may we need a whole nother session to go into this, what happens at this one particular moment. So I'm really keen to continue that discussion. But thank you both so much for this. It's been great.
Oh, thank you both. Thank you both. That really speaks this point that you're bringing up at the end, Terri, about the being most interested in following on about the impulse. Really speaks to the unconscious alliance, I think, that's alive here with us, because that by chance happens to be the area that I am most fascinated by right now, and I'm actually yes, looking at that in all sorts of ways. I agree with you. I think that is a pivotal point in all of this, and something that ISTDP has brought into the mix for me that I never had with any other form of therapy that I'm trained in. I trained in lots of models, and that is the part of the ingredient list that is making this form of therapy so much more transformative in the work that I do. Anyway, it's giving me access to do things in the room and for people to change in ways that I've never seen before in other forms of therapy that I've used. And I see some of that, I think, as being it's, to me, the action impulse is sort of liminal. It's like the point between the internal and the external. It's the bit right before it comes out of us and becomes action. And I think there's something really important about that. So yes, this has just been such a pleasure and a delight, and I feel that I've only really just scratched the surface of so many of the areas that I would love to dive in. I hope it's been useful. I have a tendency to go off in 30 different directions.
No, it was very good.
It's been great. It's been such a pleasure.
wonderful. Thank you.
Yeah, thank you.
Thank you so very much.